To Cyberswitch, the channel where we discuss all things IT. I know this is a bit of a newsflash, but the coronavirus, it appears to be in full swing. I mean, the outbreak is here. It's spreading pretty rapidly around the country. I'm here in the United States, Atlanta to be very specific, but I mean, it appears to be in full swing. My name is Marcus. I'm the managing director of CyberSwitch Technologies. We're an independent business communications engineering firm based in Atlanta, Georgia. We have relationships with over 250 vendors on a global scale to assist you with your IT needs. We are consultants, so we work with IT directors, CIOs, and CTOs, Fortune 500 companies, states, cities, counties, professional sports teams, banks, and hotels to maximize their operational efficiency. We're often in the C-suite crafting policy, evaluating vendors, consulting on strategic plans, and that's why I'm shooting this video. The title of the video is Information Technology and Coronavirus. I hate to say it, but folks, we are here. If you don't know what I mean, watch the news today about coronavirus, also known as COVID-19 and novel coronavirus. It's here in the United States. It's here in Atlanta. It's here to stay. This brings to mind movies like Contagion and Outbreak. I mean, this stuff's pretty scary. Not trying to scare you, but the reality is that we are facing some very serious challenges and we really need to plan. So I'm going to attach the link to this site that allows you to kind of watch the data on the outbreak. What I want you to focus on is this is data from 3/1, March 1st, which is Sunday. I want you to see how things change in just a couple of days. So from March 3rd to the 4th, we go from 86,982 total confirmed, 2,979 dead, to 94,251 and 3,200 dead. So as everybody knows, there's some hot spots, China, South Korea, Iran, Italy. Yeah, so this is approaching the P word. I know that nobody wants to say it on the news channels, but we need to start discussing pandemic. Here's where we are in the United States. So again, 3/1, we got 71 cases, and then 3/4, the United States has 128 cases. So that's less than a week. It's almost doubling. So we live in a global economy with people traversing the world in record time, and that really enables pathogens free reign in terms of the numbers of hosting opportunities. So I'm posting this video because as a technology company, technology really has to be a part of the solution. It's software, it's data science, it's biotechnology, thermal imaging, it's every technology that you can imagine. I was talking with a large customer today, and his response to my pandemic plan question was, that's not my area. I thought, yikes. I proceeded to share some technologies that would help, from screening external visitors, cameras at entrances, in-office telemeeting, teleworking. All leaders, especially IT leaders, in conjunction with HR, should have a plan for what to do when this arrives at their doorstep. We just can't continue business as usual under the circumstances and hope that somebody else takes care of it. Many technologies are already in use in airports, hospitals, etc. We need to begin thinking about alternative uses of these technologies. This is soon going to be everyone's issue, and we really need to band together and solve this problem. Here's a nice, nasty picture of the coronavirus. I mean, look at those red, looks like tines and orange. I mean, this is a nasty little booger right here, I tell you. Unbelievable to actually see what it looks like under a microscope, huh? There are several troubling things that I want to discuss that really are reasons why we need to be concerned. Number one, this virus is 20 times more deadly than the flu. This is a new pathogen, and it's 20 times more deadly. So 0.1% versus 2%. Now that doesn't sound like much, But for comparison, that 0.1% in 2017 killed 61,000 people here in the United States. In 2018, 2019, that was 34,000. So by comparison, 20 times doesn't sound like much until you're talking about 800,000 lives here in the United States. And if that were the case, I guarantee you everyone would be impacted. Number two, the incubation on this is very concerning because it's anywhere from 14 to 27 days. That's a very long incubation period versus a cold, which is 24 to 72 hours. So the reason why this is important is because the symptoms are the things that tell you that you need to take precaution. Fever, coughing, headache. That's an indication that you need to self quarantine, go see the doctor, all those things. But if the incubation period is 2 weeks, I mean, you could be walking around with this thing for 2 weeks, contagious, and not really realize that you're passing this on to other people. And I think that's what's going on, or that's what was going on up in Washington, Seattle, is that people didn't know they were sick and they were transferring this disease to others in that nursing home. Whether it's 14, 27 days, I mean, that's why you have these long quarantines. That gives you an idea of how serious this is. Number three, there's no resistance because it's new. I mean, a lot of us have, gotten colds, things like that. The common cold is the coronavirus, but believe it or not. But we've built up resistance over the years, and so it doesn't impact us. And so the body's kind of pre-programmed. It recognizes this virus, and so it runs its course. Usually it's done in, 3 to 4 days. In a very long case, you might have some congestion for a week or two. But again, because this is new, our body does not recognize it. Number four, there's no vaccine to this virus. It is a virus. I mean, if they could build a vaccine for a virus, why don't they have one for the common cold, right? Maybe because it's not so dangerous. But from what I've heard is that you can't eliminate viruses. The best case is that it's going to take 18 to 24 months before you get a vaccine, something that will dull the impact of the virus or reduce the symptoms. Number five, it's very contagious. When medical professionals are getting the virus and dying, that tells you right there it's very contagious. It's doubling in less than a week, as I showed you in the U.S. Now you would think, it's only doubling, but if it continues at that rate just here in the U.S., let's do a little math here. That's 1 million cases in the U.S. in 1 year. At 2% dead, that's 20,000. So I have a question for you now. How long would it take from that 1 million to get to the total U.S. population of 331 million? Just over 21 months. So that would translate to 6.6 million dead. So now you understand 21 months versus the 18 that it would take to get a vaccine. I mean, we really need to hurry and jump on this thing. So doubling every month in terms of the rate of infection is very high, and you can see right now with the math why people are concerned. Number six, people who feel fine are testing positive with no symptoms. Okay, so that's related to the incubation, but I wanted to make sure I underscore this with an additional point, and that's that you can feel great and still test positive and have no symptoms. So again, you could be walking around to a deadly virus that you're transferring to other people. Number seven, there are really no plans for what to do here. Man, we haven't really dealt with a pandemic like this in a while. 1918 is the last time a very serious one impacted the United States. And I think that's certainly due to the fact that the healthcare system is one of the best in the world. But especially on the commercial side, there just aren't any plans. And I can tell you this firsthand. I've talked to customers of very large organization that lots of people visit, and I can tell you there are not intricate plans in terms of how to deal with this. Don't wait for the federal government to take care of this. Have your own plan. If the pandemic of 1918 taught us anything, it's that a new pathogen can wipe out a large swath of the population. It infected 500 million people, or 27% of the world population of 2 billion people. Even the remote Pacific Islands were affected. So you would think, oh wow, yeah, I'm safe out here in the middle of nowhere, but no, even the travelers there were able to, make the islanders vulnerable to that disease. An estimated 40 to 50 million people died. Some estimates are as high as 100 million people dead as a result of the 1918 flu pandemic. Very high number. And again, that's why we're concerned. We've been teased by swine flu, Zika, SARS, Ebola, and my point is that eventually we will deal with the real thing. And so, that's another reason why we really need to take this seriously. Is warm weather going to give us some relief? I'm not sure about that. I mean, have you ever caught a cold in the summertime? That's coronavirus? Yes, it happens. You're more miserable. I tend to catch them less during the summertime. I guess the sun kills more of the virus. It doesn't last as long on surfaces, but still, that doesn't mean it can't be transferred during the summertime. The time to plan was really yesterday. Now is really the time to act and put that plan into motion. It's not rocket science. It's just doing the things that you know that you should do. And from an IT perspective, it's really the same. The biggest thing is you've got to have a plan. I can't underscore this enough. And this is really where, I want to be able to help you. I want to tell you a story about my friend Brian. He was the manager of a direct marketing organization for a nonprofit disaster relief company that I used to work for. He was always 5 steps ahead of everybody else, always prepared, knew his numbers, always met his targets. He always had a well-written emergency plan in case of a global disaster. He just wanted to be ready. That was really smart since that was our business that he had a plan. So when the tsunami of 2004 hit in India and Southeast Asia on Sunday, December 26, killing 230,000 people and causing 115 billion in damages, Brian was prepared. He already has his plan in place. Everyone else was at home spending time with family over Christmas and didn't return to the office until January the 2nd. So what he did is he broke the glass on his plan, which included ad copy, a marketing plan, contingency phone coverage, and the specific publications that he wanted his ads to run in. So his disaster relief ads ran for an entire week before anyone else even returned to the office. Needless to say, his department raised a ton of money during that week from people that wanted to help. I mean, his ads were everywhere. Washington Post, Wall Street Journal. I mean, you name it. He was there front and center because he was prepared. So the best defense is really to have a plan. If you don't have one by now, you better hurry. It's incumbent upon all organizations that require many people to visit them to have a plan. Unless you're single and work from home, you're really vulnerable. Your threat vector or cross section is very large. We all go to work, we have kids that go to school, we go shopping, we work out, etc. It's really crazy when you think about it. The virus has over a 2-week incubation period, and again, that's why you have the very long quarantines. You could be contagious for 2 weeks without even knowing that you're sick. So, I mean, how scary is that? I have a friend, he's got some relatives that just got back from Italy, and they're supposed to spend some time together. And I'm like, dude, I wouldn't do that. I would let them stay sequestered for a little bit, just to make sure they're clean. And I know it's family and everything, but I mean, this is life and death that we're talking about here. So this is the most concerning thing besides the mortality rate, of course, and it's really important for people that have large crowds and lots of traffic to have a plan. Think about how many screens, checkout, payment touch screens. Think about the door handles that you touch on a daily basis, banking, credit card machines. You enter buildings, elevators, even registering at the doctor's office. I mean, think about the touch screens that you utilize now. It's nice to get rid of that paperwork, but now we have to worry about coronavirus. So you have to really think about the activities that put you in harm's way. Imagine having to hunker down, in the case of a true pandemic for 2 to 4 weeks, I mean, or maybe even longer. Do you have enough food so that you don't have to go to the grocery store? Could you do it? Again, the time to plan for that is now. So let's look at some of the more popular places that we would, these are places that you have to go. School. What could you do with school? You could go online. A lot of schools right now, they actually practice by making the kids take online classes, like I don't know, once a month or every other week, something like that, just so that they're prepared. It's not new when they actually have to do it for real, and all the bugs have been worked out. You have to go to work. A lot of people are teleworking now. I know that's something that I do a lot. My wife does the same thing. Businesses should have a plan for teleworking before tragedy strikes. I mean, we should really equip our businesses to function when everybody's not coming to the same space. I mean, there's really no reason with electronic records and everybody's got a laptop on a computer. There's really no reason why, in a situation where you got pathogens floating around, why everybody has to come into the same office. Groceries, mall, shopping. I mean, people have been doing this online for years, so there's really no reason why you can't do this now. I know a lot of the grocery stores, you can call up and, you don't even have to, all you have to do is touch the signature screen, so I hope they'll take care of that. But you can order online, call when you get there, and they'll even put the groceries in your car, so you don't even really have to touch anybody. So I know that eBay does great delivery, Amazon, Walmart, Publix. Insert the name of your particular grocery store if they do the call-in service, curbside delivery, whatever it is. And then let's move to movies, entertainment. They've already considered playing March Madness without a crowd and just showing it on TV just to protect the public. Movies you can do online. So there's a lot of things that we can do to get the things done that we need to get done without having to put ourselves in harm's way. Registration for driver's licenses. You should be able to do this online. Maybe this epidemic will push these state and local governments to make that priority. But I know I just renewed my tag the other day, and you have to go inside, touch a touch screen, sit down in a crowded lobby. I mean, there's plenty of opportunities to get infected by some sort of airborne pathogen. So my point is that we need to think about how we can utilize technology to make this easier. We got the election coming up, and we should be able to vote online. I know there's a lot of reasons why, in terms of cybersecurity, that people are concerned about this. But if you can bank online, you ought to be able to vote online. I mean, you can stock trades online. Why can't we vote online? I don't get that. But those are the places that you have to go, and so that should kind of give you an idea of some techniques that you can utilize to stay out of harm's way. So in terms of technology, here is what's coming. Bluetooth access to buildings where you don't have to touch the handle. Bluetooth signatures, so your phone's attached via Bluetooth to the signature card. You touch your phone and your phone only, signature goes through, and you're done. And this is great. I'm a hypochondriac and a germaphobe, so this is great for me. You don't have to touch anybody, nobody touches you. Teller machines, they've already got it right now where you can Bluetooth into the teller machine without having to press all the buttons, so that's nice. I just mentioned voting machines. So how do I know that all this groundbreaking security technology is coming? Well, it has to do with the edge devices. I used to work for a startup that specialized specifically in this. DNI is the name of the company that I used to work for. That's really on the cutting edge of some of these more secure protocols for edge devices. So they got a very neat approach to edge security, and I mean it's a very new product category called SASE. You can research that. It's called Secure Access Service Edge, and it combines networking and security for edge products like phones, laptops, IoT, cars, things like that. So it's a great approach. They're currently working on getting this tech into the federal space. Full disclosure, I do own shares in the company, so I hope this really works out and goes mainstream. There's got to be a commercial approach to make the public safe. I'm not going to stay at a hotel that can't show me that they have a plan and are compliant with that plan. That they're cleaning the room, spraying it down, not just bed sheets and pillowcases, but I want to know that that they have a protocol to make sure that if somebody stayed in that room and they have the virus, I'm not going to get that virus. I mean, this is seriously going to impact hotels, restaurants, movie theaters, and as the public, you have to demand change. I mean, this is very serious. You better believe that anyone, including the President of the United States, would be subject to quarantine if he tested positive. I mean, at that point, the public health would be paramount. Just be glad that we're more civilized than the Scots. I've left a link in the comment section about Mary King's Close. You should look this up. It's a Scottish town that was bricked up in 1645 with up to 300 residents inside, presumably to contain the plague. But that was their way of dealing with it. Now, this is only a suggestion on my part, but I suggest that we deal with things in terms of a progression, a threat level related to where we are. So, in this model, there are 5 primary rings. All indications are that at some point the virus will impact all of these rings. The strategy is in place to avoid the next ring, right? So what you want to do is you want to be extra vigilant on the outer rings so that you don't get to the inner rings. Because as you get to the inner rings, of course, that means it's closer to you. So you want to avoid the next ring at all costs. But you also want to have a plan for when that happens. So stage 1 or ring 1, it's the global ring. So we've already breached that. That means it's in existence around the globe. So in this case, you want to voluntarily work from home. You want to sanitize on a regular basis, cover your mouth when you cough. You want to cough into your elbow. That's kind of a standard way of doing that. Stay at home when you don't feel well. But the reason why you want to be vigilant at this stage is that we're all connected. I mean, you can get on a plane from China, fly to Atlanta, interface with several people that are going all over the world, at the world's busiest airport. And in less than 24 hours, you can literally infect the entire world. Stage 2 is the country ring, so it's in your country. Now, when I decided to do this video, it hadn't been detected, the virus, in the United States. So I was thinking I was at stage 1, and here I am thinking, okay, I need to prepare so I don't get to stage 2. Well, guess what? We're here. So it's in the country, it's in the United States. At this point, you want to be, again, super vigilant, do everything you did in stage 1 plus stage 2. So if you've got a workplace environment, you want to sanitize that workplace environment every week, at least once a week. I would try to sanitize midweek. In this situation, you want to start keeping social distance. Minimize large meetings and gatherings. If you've got a weekly employee meeting where everybody goes into the theater and gives their update, don't do that now. We're in very serious times. We need to start taking serious measures. So start thinking about other ways that you can communicate without having everybody in the same room. So I suggest as well, if you don't have to go out, don't go out. It's like the example of the grocery shopping. I mean, there's plenty of opportunities to shop at places that will pull your items and deposit them right in your car without any extra charge. So just go ahead and use that. Why expose yourself to all the traffic that's in the store? It just doesn't make any sense. Now, I don't know if there are many companies. I know more of them will pop up. I want to back up a little bit to sanitization of the workplace. I suggest hiring a company whose sole job it is to sanitize key areas, bathrooms, elevators, stairwells, and that way you're hiring a professional. They're trained. They'll have all the gear. They'll have all the disinfecting solution, things like that. Don't try to do this yourself. Again, I thought that I was dealing at stage one. I'm here in Atlanta, and not only am I not stage one, I'm actually at stage four. So it's not just in my state; it's in my city. But we'll get there in a second. So at stage three, you really want to start to understand that it's very close to you. So you want to be extra vigilant in terms of the voluntary online schooling. Let your people work from home. Go ahead and put that plan into place. I'd be sanitizing once a day instead of just once a week. Again, limit the large gatherings. And if you're going to sit next to somebody, don't sit right on top of them. Okay? I mean, people are concerned. I was in the, like I said, I'm getting over a cold. I was in the line at the DMV and I coughed, and you would have thought I had the plague. Everybody turns around all concerned. But, people are afraid. And so, that being the case, don't sit right on top of people. Give people an additional, 3 to 4 feet if you can, when you're in public. Stage four, it's in your city. So this is where I am. We got 2 people in the city of Atlanta that have actually tested positive for the virus. They're in quarantine right now. I guess the only good thing about being in Atlanta is the CDC is in Atlanta. So that'd be bad pub for them if if Atlanta were to grow into a hotspot. So they're going to be extra vigilant to make sure that doesn't happen, I'm sure. But once it's in your city, I would go to 4 times a day sanitation. Again, avoid the large gatherings. If you're invited to a large gathering, don't go. There's really no reason to do this, until we get this thing under control. Voluntary telework again. At this point, I would go to mandatory online schooling. I mean, there's no reason why we should put people and children in harm's way. Again, we want to do everything in our power to make sure that we don't go to the next stage. And mandatory online schooling is what, in my mind, would do that. Larger companies, I would go to video surveillance. They've got some technologies which will actually thermal scan all the visitors. I mean, imagine having somebody that just got back from, China, Iran, or Italy, walking into your lobby and eating lunch with all your key employees. I mean, that's a huge threat to your company. We've got a lot of headquarters here in Atlanta. Cox, Home Depot, Coca-Cola. I mean, imagine an affected person walking in and impacting the entire company. It's a very serious time, and not only is it impacting lives, it's impacting bottom lines, as you can see by the fluctuations in the stock market over the last couple of days. So, again, be extra vigilant. Stage 5, it's in your office. And this is why IT managers, HR directors, you've got to have a plan long before it gets to this point. It's already in most major cities. So the probability of it coming to your office is actually very high. But again, I would hire a company to do sanitation. I would do it hourly, just to make sure that we are not doing anything to allow the pathogens to spread. I would do mandatory telework for 2 weeks. If you have somebody in your office that tests positive for the virus, I would make sure that everybody else that tests negative gets to work from home for 2 weeks. No large gatherings, period. Okay, no, not just avoidance or refusing to go. It's got to be mandated from on high that we are not going to have any large gatherings. And even if you have small gatherings, there's no reason for 3 people to be sitting in a small office, you know, recycling the same air. I mean, you utilize, some of the online meeting tools that are out there. There's a ton of them. And allow people to sit at their desk in their space, and you can meet that way. So the bottom line is that life has to continue. You just can't sit in your house. You have to eat. Your kids still have to learn. You still have to work. All these things must continue. Can you imagine the global economy just grinding to a halt just for a couple of days? I mean, the supply chain on a global scale is fluid. It like never stops. Go see the movie about the 2008 recession titled The Big Short. Great movie. But this will give you an indication of how connected everything is. A small problem in the subprime market cascaded all the way through the entire U.S. economy, bringing us to within inches of a national financial collapse. And had the U.S. government not stepped in to bail out our economy, the banks, the automakers, the insurers, I mean, everybody. I mean, where would we be today had they not bailed us out? The good thing is that the U.S. government will always print more money to save itself. So there's nothing the government won't do to save itself. It's not about you, it's about saving the government. This is the type of thing, this pandemic, that can literally wipe out a company. I would not be surprised to see this question on insurance applications for general liability, professional services coverage. I mean, how risky are you as a company if you don't have an IT pandemic plan? That's how you show that. That's how you show your insurance provider that you have a mitigation plan. That you're less of a risk than a company that does not. So I would not be surprised if this began to affect renewal rates. We can assist you with this plan and make sure that it's validated by IT and healthcare professionals alike. Now, what does all this mean? Will we survive? I mean, who knows? But we can look to technology to mitigate the impact. You need to be responsible and vigilant. I mean, how does a guy in California get sick, go to a hospital, and stay for almost a week before getting a coronavirus test? I mean, China is not that far removed from California. I mean, there's probably daily flights in San Francisco. So I don't know how that happened. If you have intelligence on how that happened or what happened in California, update us in the comment section. I mean, really. So I think in terms of technologies that can assist us, it's touchless elevators, touchless door handles, sanitization stations, plenty of supplies, masks, wipes, gels. You're going to see drone delivery of medications and things like that, online meetings, surveillance with thermal sensing technology, elastic connections, internet connections so that corporate connections can handle the additional bandwidth of everyone working from home. You're going to see advanced ventilation systems like what you see in an airplane. You're going to start seeing those in the office. And there's probably some other ideas. You post those in the comment section. So let's say you did have to hunker down. What are the things that you absolutely have to do? where would you have to go? These are the organizations that must have a plan. School, grocery store, doctor's office, hotels, Airbnb. I mean, these places have got to be disinfected after every guest, to make sure that all the new guests are safe. Malls, restaurants, events, opera, football, baseball, basketball, high school sports. I mean, I'm out all the time. And so all these event planners and people that ensure these events, everybody's going to have to step up their game. Think about the taxis, Uber, car rentals, airports. I mean, the list goes on and on. So what I'm suggesting is a PITO plan. You've heard of pita bread? This is a PITO plan. Pandemic Information Technology Optimization Plan. And all it is a plan utilizing technology in the event of a pandemic situation that allows you to optimize your school, work, event, things like that. Again, you've got to have a plan. There's really no way around it. Dealing with a pandemic without a plan is just asking for trouble. And we've seen that on the news as some of the leaders have been questioned by our elected officials. I'm concerned when they don't have answers. So again, I'm asking these questions as a technologist because I feel like we should be part of the solution. The markets again are telling us that this is very important. A company gets hacked or some HIPAA information is handled improperly, the stock doesn't drop 10% in market value in the entire year. But our markets have dropped almost 15% in 5 days. I mean, that tells you that this is very important. Now, I know we've recouped a little bit of that value in the last day or two, but still, the market is speaking loud and clear. Hey, guys, we're concerned. This is very important. Get a grip on this. So if you need any advice on any of these technologies, reach out to us today. We deal with over 250 vendors on a global scale. If you need help, reach out to us at info@cyberswitchtech.com. You can book a meeting directly from the website, cyberswitchtech.com, or you can call us at 678-235-9076. And your question can relate to anything. Sanitization, telework, online education, carrier services, unified comms, cybersecurity, surveillance, or even drones. We have expertise in all of those areas. We just signed our first professional sports team, which is a milestone for our company. Many people go their entire careers and don't get to work with one of these franchises, so we're really excited about that. I've attached several links that are sources for the things that I've discussed. Thank you for your time. Please click the like button and subscribe for other IT related content.